Hello, good to see you. My name is Fred van Eenenaan. I'm chairman of VBHC Healthcare Center Europe. I've been active in value-based healthcare implementation work for the last 12 years after Porter wrote his famous book. Delighted to be connected with you. I think it's very, very important, as you well know, that the contracting bit and the pay for outcomes and the pay for performance, that is moving forward. It's a very important part for both patients, for payers like you, for providers, and of course for society. So I'm very, very excited to be at your next event and bring some examples and hopefully can have some discussion. I'm always delighted that at the next event we will allow you to do a 2 days VBHC Greenbelt. That is, I think, for you and as well as for your colleagues, very, very nice to understand how value-based healthcare implementation works. We have more than 1,300 implementation cases of VBHC worldwide, and in the course we use 112 of those. So that I think is highly, highly recommended. And I know that your and our team are thinking about and trying to organize a tour to see what are the current good practices and learnings and how we can jointly move forward on better contracting and better pay for performance and do that in a better risk sharing and better way. So absolutely delighted of the connection with your institution. Let me give you a little bit more detail, a little bit more background. So VBHC Healthcare Center Europe has been founded since 2008 with VBHC Healthcare implementation enthusiasts. That was absolutely wonderful, and it has grown into a platform of more than 100,000 people regularly connecting, 6,000 people having now a VBHC Healthcare Greenbelt. We have some other certifications as well. Our favorite day of the year is when we can hand out the VBHC Healthcare Prize and Awards. Porter is the honorary chair, and we have had a lot of great examples. And fortunately, we see since the last 2 years that, let's say, bundle payment or outcome-based payment, as well as stronger digitalization, is becoming part of these wonderful initiatives. So I can strongly recommend you to follow that, to point it out to your colleagues and be connected with us and bring this forward. Another thing that I'd like to share with you is the Decision Institute. I have founded the Decision Institute for a couple of years, actually 15 years. The Decision Institute strongly focuses traditionally on in-house and in-company training and education. It also has a lot of open programs, and part of that is the value-based healthcare education. So we have a 2 days intensive green belt, we have yellow belt, and we have black belt, and we also train other faculty and people around the world who can sort of deliver those trainings there. So wonderful to meet you all. Thank you so much to iFHP for reaching out to us. I'm looking forward to a wonderful collaboration. And please, in the meantime, if you have any questions, feel free to join the LinkedIn or become a member or ask questions or look into some of the articles and prize winners that we have for the last 10 years. Thank you so much, and I wish you a wonderful conference and a wonderful day.